Hi, I'm Dr. Alicia Dickinson of McKee-Pownall Equine Services, and today we're going to talk about the new foal exam. All new foals require a veterinary exam within the first 12 hours of life. Veterinary assistance may be needed sooner if problems develop. These include a foal that has not stood within the first 1 hour of life, a foal that is not nursing productively within the first 2 hours of life, or a placenta that has not passed within the first 3 hours of delivery. This is the rule of 1, 2, 3. As long as things go routinely and your foal seems healthy, you should call your vet first thing in the morning to schedule a new foal exam for that same day. The most important component of the new foal exam is proper restraint. The foal should always be restrained with one arm, usually your dominant arm, around his chest or neck, and the other either holding the tail or sometimes just holding behind the haunches, but the tail will give you a better grasp. Never reach down through the abdomen and restrain the foal that way, because there is a risk of rupturing the very fragile newborn bladder. So we start the exam usually working at the head and working towards the back end. We always have a look at the gums, make sure they're pink moist and they've got a normal capillary refill time of 1 to 2 seconds. We also check their alignment to make sure there's no parrot mouth or overbite or underbite. We always slide our hand in. They don't have teeth at this age, which helps. And we slide our hand in to make sure there isn't a cleft palate, which is a hole in the roof of the mouth. We always check to make sure as well that they've got a pretty strong suckle response. We want to make sure that the eyes are clear, make sure there's no congenital cataract formation, and no discharge. Move along to a skull, the heart, lungs, and the trachea. We're checking for any heart murmurs, which are very common in newborn foals. Have a listen to their lungs, make sure that they are clear, and make sure that there's a normal rate as well. It is customary to take a rectal temperature. And normal for a foal will range anywhere from about 98.5 to 101.5 Fahrenheit. We always have a feel of their umbilicus. It's very important to make sure that it's no longer bleeding, that it's dry, so that not suggesting there's any urine coming through. An important component of the newborn mare and foal exam is, of course, adequate and thorough evaluation of the mare. She's obviously gone through somewhat of a stress and trauma, and you want to make sure that she's doing it as well as the foal. It's really important, in particular related to the foaling, to listen to their gut sounds, because they often do slow down quite a lot, and to have a really thorough palpation of the mammary glands. To make another important component that relates to the mare in particular is her digital pulses, because any evidence of uterine infection or retained portion of the placenta will cause digital pulses to become markedly elevated. In particular, relating to the post-foaling mare exam is evaluation of their perineum, and including their vulva. Always ensure you keep the placenta for evaluation by your veterinarian. Your veterinarian will look at the outward appearance, look at the size and weight, and look at the interior and exterior surfaces. It's essential for your vet to determine that all portions are intact and that no portions of the placenta were left inside the mare. Remember, only your vet has the knowledge and expertise required to accurately assess your new foal. Thanks for learning about the new foal exam. Never hesitate to contact your vet with any questions.